Greetings, everyone, and welcome to our second noon seminar for the Department of Population, Family, and Reproductive Health. I'm Cynthia Minkovitz, and I have the honor of welcoming you to part 2 of the stories of our faculty. So this is always a really fun time of the year where we get to tell you a little bit about ourselves that you probably won't read on our bio page. For those of you that weren't able to join last week, you're in for a real treat. So a special shout out to those who are online as well. And what we'll do is similar to last time. We'll just ask each faculty member to, within like 5 minutes, to tell us a little bit about what makes them tick and why they're here. So to start us off, I'm going to welcome Dr. Bethell.
Hi, everyone. I'm trying to get hooked up to my computer, so I'm on my phone right now. Thank you for inviting me here today. And I don't know if I know all of you, I can't see you, but when I thought about what I wanted to share, it occurred to me to share that I'm actually an accidental academic. And what that means to me is I was all excited about running a health system that was whole person oriented and community based and finance to focus on prevention. And I discovered that wasn't what existed. And so I kind of fell into my work through that original vision and passion. And for me, I think it's really an important sustaining thing in our work to remember what got us started and what remember and never forget that, because that still might be the motor that's driving us. And it may require us to change routes. Like for me, I didn't plan on getting a PhD, but through the process of this vision that I had and learning it wasn't true, I did an MPH MBA, never planned on doing a PhD. You know, I really got pulled into places that I would have never, ever thought, especially the quantitative and the system science and things like that. So my story is kind of one of following, and then also, what do you do with the deep care in a world like ours? Like, how do we stay resilient when we're faced with the gap? And in many ways, the gap in what we vision and what can be is what gets us going, right? Why you might have applied for this program and doing the hard work that you're doing. And for me, that issue of personal resilience is very important to just ask, you know, what is it that I need to stay in the game? And I think that that was not something that was talked about when I was growing up. It was just sort of, you know, full throttle. And, you know, we're going to actually change it, change the world, right? And that's a beautiful vision. But I thought if we could measure quality and measure the needs, then all of a sudden policy would change. That was very naive. I was very young. And as I've gone on, it's just been really important to look at resilience. And for me, that's mainly come in the form of colleagues and people to work with. And so, you know, my story today is more just encouraging you to think about what got you started, remembering that initial spark and staying the course with that through the bramble. To be led by that, but also really thinking about resilience and all the relationships that are needed for us to keep that. And I don't know if that was 6 minutes. I could go on, but that was basically my main story. Should I say more?
It's perfect. So thank you so much. And okay. I love the idea of being an accidental academic. So I don't know, maybe that applies to others of us in this room too. So great. Thank you so much, Kristin. Appreciate you being here.
Thank you.
All right. So we have a mix of in-person and hybrid folks joining us today. So I'm going to welcome up Dr. Phil Anglewicz.
All right. Hi, everyone. Welcome to Hopkins, and hope things are going well for you all so far. So my name is Phil Anglewicz, and I'm an associate professor in PFRH. And when I think about what brings me to work and what motivates the work that I do, I'm brought back to my time as a Peace Corps volunteer in Malawi, where I served between 1998 and 2000 in a kind of a rural part of the country towards the north, close to the border of Zambia. So at this time in Malawi's history, and really the history of the region, it was just devastated by the AIDS epidemic. And that was true where I lived, certainly. So I went to numerous funerals each week. People were terrified of infection, and there was just overall great uncertainty in everyday life in Malawi due to this constant threat of mortality. So my work was tied to this. I was a HIV education volunteer. So for the first part of the time I was there, I went around to, schools, community centers, health centers, and so on. And I taught people the basics of HIV, like how it's transmitted, how to avoid infection, and so on. So I did that for the first part of my time there. And then a pivotal moment came after I was there for about 9 months when my friend Austin, he was kind of a community liaison for me. So he helped with translation and helped me understand Malawian culture. He asked to have a conversation with me. So he took me aside and he said, so Malawians, first of all, are very polite and they like to cushion, bad news. So the first thing he said to me is, Phil, we really like that you're here. And in not so many words, he basically said, you're kind of goofy and you make us laugh. So you're a source of entertainment for us. So we're kind of glad that you're here in our village. So we appreciate that. And I was like, all right, well, I guess that's a compliment. So thanks, Austin. And then he moved on and he said, but what you're telling us about HIV, we already know this. Like we've heard this for the past 10 years. Is there anything new that you can tell us about HIV? And I said, no, that's what I was trained to tell you. And that's all that there is to say at this point. So there's really nothing new. So it was through this conversation, I realized, I kind of have an epiphany that there was a fundamental, and pretty big disconnect between the goals of the program that sent me to Malawi and the needs of the local population. Where I'd been told that Malawians weren't talking about HIV at all. I was told they didn't really understand a lot of how it's transmitted in the basics, and that they weren't changing their behavior. And none of this was actually true. And the more time I spent in the local population, the more I realized how misguided this program was. So that motivated me to go to grad school and learn more about this dynamic. So in grad school, I learned that, the typical approach to HIV education at this point was called ABC, encouraging people to abstain, be faithful, and use condoms. And that just wasn't really appropriate within local context and local culture. So it's not like it was dismissed, but it wasn't really, didn't really resonate with people, and because it didn't come from the context of their own culture. So instead, we learned that Malawians were doing other things like, divorcing spouses who are a potential source of risk, or scrutinizing new partners based on their potential HIV infection. So it wasn't at all that Malawians weren't doing anything and that they weren't talking about HIV. It was more that, what they developed their own strategies through their own local culture and behaviors that made more sense to them. So, all this for me led to a pretty, fundamental point that if you don't understand your local populations and you don't take the time to learn about their culture and their practices, then your programs directed towards them aren't going to be successful. And it's a fairly simple point, but this is something that I've seen manifest itself a number of times in public health programs and other types of programs. So I think this is the kind of dynamic that for me, I think presents a challenge, but also an opportunity that continues to keep me engaged in the field. So nice to meet you all. Thanks again for the time and attention, and look forward to talking to you more in the coming years.
Great. Thanks so much, Phil. And now we'll go back to our online faculty. So I'll invite Dr. Terry Powell to say hello.
Greetings, everyone. Let me come off camera. There we go. Hello, everyone. How are you? I hope you're well. Welcome to Hopkins. Thanks so much for coming today. For those of you who are new, thanks so much for choosing us. So yeah, and following Phil and thinking about, I had 2 stories planned for today, and I figured I'd make a game time decision. So today, I think I'll talk a little bit about the younger me and the current me. So if you would have met, I am here in the department. I've been here 12 years, and I focus on adolescent health. And if you would have met me in middle school, I would have told you that, and you asked me like, oh, what do you want to be when you grow up? I used to tell people that I wanted to be a pediatric cardiologist, right? Let's be clear. I didn't know a pediatric cardiologist. I don't know if I knew any doctors besides the one I went to. There were no doctors in my family. And this was before Grey's Anatomy. So I don't know quite where I got that, but maybe it was impressive, right? And so as I think about it, I did not become a pediatric cardiologist, but the essence is still there, right? Like I think that, you know, when I reflect back on what I thought it meant, what it meant to help kids live, right? Like to help, like when things seem kind of dire, like you can help people live, you can help young people. And I do that, right? Like that's what I do in my work. I partner with community-based organizations, schools, churches, libraries, whoever wants to help kids live, right? Like, of course, like many of us in this department, we usually have an outcome, and, you know, mine are often sex or drugs or something related to those, but really it's all about helping kids live, right? Like how do we harness all the resources that we have from our communities, from our families, from our schools, and from young people themselves, so that they can live very full lives. And so while I didn't become a pediatric cardiologist, like I think that the idea of helping kids live remains. And that's why I come every day. And I hope that there is a something that either you remember from the younger you, or, you know, the more recent you, that you think about like, man, yep, this still matters to me. Like helping kids live full lives, despite where they come from, who they're born with, where they live, the circumstances in which they are living. How do we help make sure kids get to achieve optimal health, and whatever that looks like for them, right? Not how we've prescribed what it should be or how we've lived our lives, but really, how do we help kids live, right? Not always focusing on preventing illness or preventing disease, although that is certainly a part of what I do. Ultimately, like I'm here, and my career goal is to make sure all youth are safe, healthy, hopeful, and connected. And, you know, I hope that some of you are also interested in adolescent health. Feel free to knock on my door. I'm in E4614, usually on Mondays, definitely on Mondays, and sometimes on Wednesdays or Thursdays. So that's me. Thank you so much for giving me the time to say a little bit.
Thanks so much, Terry. I think it's always great to hear about what everyone's true north is, and we'll be really curious to hear from our students who are newly joining us and our trainees about sort of what's true north for you as we get to know you better over the next couple of weeks and months. So I'm going to invite Dr. Celia Karp and friend to come say hello.
Hi, everyone. Good afternoon. Oh, quiet. Okay. Hi, are we awake? Good afternoon. How are you? My name is Celia Karp. As Cynthia said, I'm an assistant professor in the department. So I thought I would share a little bit about my journey into public health today, which I just realized it ironically started here at Hopkins, though I had no awareness of the School of Public Health, but about 10 years ago. So about 10 years ago, I was in college. My partner at the time was diagnosed with leukemia. He's doing well, actually lives in the area, very odd connection there. But he was treated at Hopkins. And during that time that he was diagnosed, I felt really, fearful, and I really wanted to do something to get involved and to help. And I ended up working for the Leukemia and Lymphoma Society while I was in college, and I became a regional campaign coordinator, organizing education and awareness and fundraising campaigns related to blood cancers, and I was in school in North Carolina at the time. I was majoring in communications and Spanish, completely unrelated to public health, and frankly had no idea what public health was, even though I was actively engaging in public health activities. So at one point, someone was like, "Oh, you should check out public health. There's a public health program here." And I quickly learned what public health was, and that I had been pouring myself into public health activities that really kind of filled my cup. And I pivoted in my second or third year, I can't remember, but I became a public health major. And started investigating different areas of public health. I dabbled in environmental health at CDC. I worked in HIV/AIDS programs at USAID, and it was really just to kind of learn about all of these different public health areas and eventually kind of find my niche, the thing that really made me spark. So I ended up in Ecuador after college, and I was working on a study related to maternal and child health. And at that time, maternal health in Ecuador the health outcomes were really poor, and maternal mortality remained really high, even though there were policies in place to ensure access to maternal health services. So I became really interested in this, and it really bothered me, and still obviously bothers me till today, that most of the maternal morbidity and mortality is entirely preventable. So there was this gap between services that were available, services that people were accessing, and reasons that people maybe weren't accessing care. So while I was there, kind of similar to what Phil was talking about, I had this kind of aha moment. I learned that these women were not going to health facilities because they felt like they weren't respected in their healthcare interactions. They felt like providers weren't taking them seriously, weren't taking their preferences seriously, and they couldn't have this really sensitive and special time that was in accordance with their own desires. So that really kind of opened my eyes to this area and brought me right here to Hopkins, where I completed my PhD in this very department with several of the folks who are in this room or online. And now I'm fortunate every day to get to work with students in the department and get to work with our faculty on different topics related to pregnancy, contraception, and other decision-making aspects of reproductive health. So I really love it here, and I just had some quick tidbits for new students in the department, things that I thought were kind of helpful for me. So first, I think Sally talked about it last week, but really, like build your network. You're all here. You made the leap to come here and build those connections, get to know people. Some of these people will be in your life for a very, very, very long time in many different roles, like Sally talked about. And for faculty, it might seem that, we are either on Zoom or in our offices, but we do want to get to know you. So come express your interest or just come chat with us. We're always excited to learn about your stories and get to know your interest and see if there is some overlap that we can connect you to projects in the department. And then finally, you will have FOMO here at Hopkins. There are endless opportunities. So seize those opportunities that interest you, and carpe diem. Thank you.
Thanks so much, Celia. As you were telling the stories of your experiences in Ecuador and sort of the maternal experiences and why people weren't seeking care, it's not so different from what we have in our own communities here, domestically right nearby. So just reminds us all why many of the issues that we think about in the department and in the school really are local to global and global to local. So thanks for pointing that out. So I'm going to invite up Dr. Erin Hager.
I brought notes and a timer, so I'm not here for an hour because I could easily go on and on and on. So I'm Erin Hager. I joined the faculty last year, so this is my second time doing this. Last year, I mentioned how I was raised in Baltimore and have never left. I'm always happy to talk about Baltimore. And how at the time, in addition to my job here at Hopkins, I was also a member of the Board of Education in Baltimore County. And I talked about seeing or being part of policy making and what that was like. However, since I was here last year speaking, this past April, I cycled off of my job as a Board of Education member. And frankly, being a Board of Education member during a global pandemic was really hard, and I don't want to talk about that today. So I've decided to not dive back into that. But I was inspired by my colleagues talking about their kind of circuitous routes to public health, and mine was also very windy. So I thought I'd share a little bit about that today. So like many of my colleagues, I grew up thinking that going to college meant becoming a doctor or a lawyer. My parents didn't go to college. My mom worked in daycare. My dad was a maintenance man. And so after finishing Lansdowne High School, which is in Baltimore County, I went to Loyola College, which is also in Baltimore. And I thought I wanted to become a physician. So I was majoring in biology. And so during my sophomore year of college, one of my science classes went on a field trip to the Carnegie Institution of Washington Department of Embryology. So I don't know if you've been there before. It's on the Hopkins Homewood campus, kind of by the Lacrosse Museum, if anyone is familiar with it. And so it's this amazing science facility, and we toured a zebrafish lab. And it was really cool. And I was always one of those kids starting in 8th grade who had multiple jobs. I've always had lots of jobs. Last year I had a Board of Ed job and a faculty job. So I mean, I've always had lots of jobs. And at the time I was working in food and retail, and I thought, I want a science job. I think this is a good thing that I should have. So I went up to the zebrafish person and asked if I could have a job. And she said no, but the Drosophila lab was hiring. So you guys know what Drosophila, fruit flies, right? So I bred fruit flies for 2.5 years for $6 an hour at the Carnegie Institution of Washington Department of Embryology. And they were these 3x3 cages. Fruit flies poop a lot, so it was really gross. And I was in there by myself. I had axolotl cages all around me, and I would scrub these cages out. And it was the greatest experience ever because I got to be in this group that was doing amazing research. So Yishen Zhang was my PI. She was a Howard Hughes Fellow. She published in Science and Nature. The guy next door won a Nobel Prize a few years after I left. I mean, this was like cutting edge science. And they brought me in as this undergraduate. I got to do journal clubs and do my own research, and I got to have my lab notebook, and I did all those things. And it was quickly, I realized I'm not going to be a physician. I need to be a scientist. And so I was hooked on this idea of discovery and doing experiments and science. So I graduated from Loyola with a degree in cell molecular biology and a minor in chemistry, and I decided I was going to be a biochemist. So I started a biochemistry PhD program, and I hated it so much. So I started it and realized that bench science was kind of lonely for me. I'm definitely a people person, and I wanted to see the translation of my research into actual people, not just, you know, on the basic science end of things. Yeah, so I ended up quitting after my first year, which is really hard for someone who's a type A overachiever. If you ever want to talk about quitting something, I can happily talk to you about my experience. But I, you know, had a lot of lab experience, so I went on to do some breast cancer research for a few years after quitting the PhD program. And frankly, I got married. I played lacrosse for a bar in Baltimore City, and I had so much fun for a couple of years, and I got to regroup. And so at the time that I was working in this breast cancer lab, I was also working as a personal trainer because, again, I always had 2 jobs at all times. And so through my cancer connections, I started learning about this public health concept. And so I realized at that point that I could really merge my passion for health promotion and promoting healthy eating and physical activity with my passion for science. And I didn't know that that was a thing. And so this idea of public health and being able to be a public health scientist got me so excited. And so then I ended up applying to actually the program here in human nutrition and international health. And that's where I ended up doing my doctorate. It was a fantastic experience. I loved being here. I actually got to know Dr. Minkovitz while I was here as a student, and it was just a wonderful, wonderful experience. And so the rest is history, I guess you could say. So my main takeaways, I guess, are, you know, experiences are invaluable, and don't be afraid to ask. So they might say no, but I know someone else. I mean, there's no reason not to ask if you're thinking of wanting to work with someone or having some sort of experience. And I'm a little envious of the younger generation who know about public health. I mean, it's just really cool that you guys are exposed to it at such a young age. Sometimes I want to say thank you, COVID, but I feel like you shouldn't say that. But I do think it helps people to realize what epidemiology is and public health. And so anyway, I just really love my job, and I love being able to get excited about science and collaborate with smart people and discovery and new ideas and figuring out how to figure things out. And so, anyway, my door is also always open. I'm here a lot. If you ever want to stop by, please say hi. I'd love to get to know you all a little bit better and talk more. So that's it. Thank you.
Thanks so much. I don't know, when I hear Drosophila, you're thinking science, I'm thinking fly swatter. I don't know, but it's really neat to hear about these early experiences that folks have. I'm going to invite Dr. Susan Gross, who's online today, to say hello.
Hi, good afternoon, everyone. I'm Susan Gross, and I'm Associate Scientist here in PopFam. And I guess I often talk about my experience with advocacy, but I think being inspired by everyone who's been talking about their path to public health, I think that's what I'll focus on today. So I grew up in Northern California. I actually was born in Berkeley, California. And from what I hear, I was in protests on the Berkeley campus as a baby, but I was never arrested. So that's a good thing. And I went to undergraduate at Berkeley. And when I went into undergraduate, I thought, like a lot of my colleagues, that I wanted to be a pediatrician and I wanted to prevent disease. And so my father was actually a physicist faculty at Berkeley, and he said, okay, what I want you to do is go through, and at the time we didn't have, this is dating me, we did not have electronic course catalogs. We had big paper course catalogs, and he gave me this course catalog, and he said, go through this and find the major that will do all the pre-med requirements you have, but also keep your interest for 4 years. And so, because we didn't have a pre-med major at Berkeley when I went. So I started going through and I came across nutrition and I was like, oh, I can do food for 4 years. I'm going to be a nutrition major. So I majored in clinical dietetics and nutrition. And I actually got into a special program for undergraduates for completing all of the requirements to become a registered dietitian and being able to go into community clinics around the Bay Area and fulfill all of my internship requirements in the 4 years that I was at Berkeley. So going into those internships in hospitals, I started following doctors. And I was like, okay, number one, they're not doing prevention, they're doing crisis. And two, I'm not really good with crisis. Like, it would be a very stressful situation. So I was like, yeah, I don't deal with crisis very well. At the same time, I was part of the Student Health Advisory Committee for the campus, surrounded by all these public health students. And that was my introduction to public health. And they're like, you should go into public health. If you want prevention, that's where you go. And I kept going with the pre-med idea. I even took the MCAT, and then I was like trying to write my essay and thinking, no, I really want to go into public health. So changed my plans, applied to program in public health in San Diego. I was really interested in children with special needs because both my sister and my brother, older siblings, had developmental delays. And I saw a whole lot of nutrition disorders among the group who had they were friends with and also I worked with in recreation that had these nutrition complications that could be prevented. So I was like, I'm going to work with this population. And everyone was like, yeah, you have to go into public health to work with that population. So I got my MPH and I came to the East Coast. I was at Georgetown at the Center for Science and Nutrition, the Center for Science for Maternal and Child Health. And I learned that they were doing public health and there were things for plenty of projects around nutrition, but there was no funding for kids with special needs at the time. That there is now, but nutrition in kids with special needs was really underfunded. And they're like, yeah, we need more research. So that made me think, okay, I'm going to apply for a PhD in public health and look at this group. And I happened to meet my husband around the same time, and I had applied to Berkeley and I had applied to Hopkins. And we were talking and he said, well, if you get into Hopkins, you'll stay. And I was like, I can't afford Hopkins. And I was lucky enough that we had the MCH training grant, and he's like, we can make it work. And so when I got in, I stayed. I was lucky enough to work with the department was maternal and child health at the time. It was before we merged with Pop Dynamics. And I was able to work with Dr. David Page, who I still work with today, and Dr. Henry Iries. And I was able to do my dissertation on eating disorders among young women with chronic illnesses. And it just made me think, and this is how I want you to think about this, is follow what you're interested in and go after the opportunities that are presented to you. Don't just think that you have to go on a specific path, because none of us have a straight path, and especially in public health. Dr. Page introduced me to breastfeeding research. I was able to work on breastfeeding. He also introduced me to the idea that if you want to work for early nutrition with kids with special needs, WIC is the place to be, because we see a lot of kids who are born with developmental delays or just complications early in childhood that can have it corrected, and this is a great public health opportunity. So yeah, so if you want to take anything away is follow your opportunities, follow your interests, and also yeah, don't be afraid to just follow a not linear path. Thanks. Oh, I want to say my office hours Wednesdays from 10 to 11 a.m. I'm online, as well as in my office E4543.
Great. Thanks so much, Susan. It's kind of ironic. We have our two nutrition experts, at least two of the many in the department, back to back. But I don't think you're going to talk about nutrition, Dylan, are you? No. So I'm going to welcome up Dr. Dylan Jackson.
Thank you, everyone. It's so nice to be in person. I've done these a few times. I'm starting my 4th academic year. Can you believe it? It's mind-blowing, but I've never done this in person, this particular event, so I'm excited to see everyone's face. So I'm Dr. Dylan Jackson. I'm an assistant professor here in the department. I'm a criminologist by training. I focus on youth, children, and families who are impacted by the criminal legal system. But I'm not going to talk about that today because you can look up the bio and all that stuff. And you can email me and we can chat in my office. But I thought today what I usually talk about kind of what motivated me to study what I study. But I was thinking about today talking about what motivates me in my approach to how I do this work, how I partner, how I collaborate, how I mentor. And there's really two things, and interestingly enough, they both have to do with children and childhood and adolescence, and that's kind of what I study. So the first is my own childhood. I grew up in California, Southern California, not Northern, like Susan. And my childhood was wonderful. I had a beautiful childhood, wonderful parents, great siblings, but I always felt out of place. I felt like a little precocious, a little like I was in the wrong place at the wrong time, and I just wanted to get to adulthood. A lot of my peers I felt were really not interested in me. I felt very excluded, very isolated. A little bit, I think I was perplexing to a lot of my peers. I was tall, I was big, but I was sensitive. I wasn't really interested in like football, and they were like, what are you? Like, you should be doing something else. Like, they didn't know how to make sense of me. And I felt really isolated among my peers. And it really, to this day, has shaped the way I mentor, the way I interact, the type of science I do, the way I approach science in the scientific enterprise as a very collaborative, compassionate endeavor. It's very much for me about connecting with people and being humble and listening to people and make sure people feel seen, make sure people feel heard, because I didn't feel that way as a kid. And then secondly, it was becoming a father. I have 3 children. I have 3 boys. I know you're like, wow, what? I'm not 21, I know. But I did have them pretty young. I was 25 when my youngest was born. So I have a 12-year-old, a 7-year-old, and a 4-year-old, all boys. And my 12-year-old was born right before I finished my master's, and I still had years of school ahead of me. I'm like, what are we doing? And I don't regret it for a second, because it really informed the way I approached school, right? My schooling, the way I thought about my career. And it reminded me that I need to stay grounded. I need to stay connected because it's about people. My oldest son has had a number of health complications, and one of them happened right in the thick of all the oral exams and me trying to wrap up my doctoral program. And I look back and I remember thinking, this is like a crisis and I'm not going to be able to make it through, but it kept me grounded, and it made me realize all of this is about people. Everything I'm doing is about connecting with people I love, people I care about, or people I don't know who just need to be seen and need to be heard. And so I would just leave with you that as you're doing this work, whether it's a paper, whether it's a research project, whether it's a class, or your careers moving forward, just always put people over projects. Always put people over the paper that you're writing, or these granular details, to put people over p-values and statistics and models, because we can get so caught up in all of that, and that's great, right? You're here to learn the skills, the tools, the best practices, but at the end of the day, it doesn't matter if you don't see people, if you don't hear people and don't connect. And that's where all of the magic happens when you do that. So I would just leave that with you and hope you can take that approach, because it's really served me well. So thank you. Wow.
Thanks so much, Dylan. I'm going to welcome Dr. Kristin Mmari. It is you. Okay, so good afternoon, everyone. I'm Kristin Mmari. And I think for today, what I'm going to share is my pathway too. It's always been winding, but I'm going to give a little different perspective, because when I was here, I was kind of stubborn in my viewpoint. I knew exactly what I wanted to do. And people were giving me nudges here and there, but I was like, nope, I know what I'm doing. So just to let you know, when I came here, I was an international adolescent health person, and that was my focus. And I loved it. And I still do that today. And my office, though, is right on the same floor as the Center for Adolescent Health, and they do primarily domestic work. So the director at the time was Freya Sonnenstein, and she would come to my office and she'd be like, Kristin, hey, come on, we're having a meeting. It would be great to have you. And I'd be like, yeah, you have a wonderful meeting. I'm going to go my way. And it became this joke. Every time she'd see me, she'd be like, hey, we're going to have breakfast. Do you want to join us? You guys have a wonderful breakfast. And I just was very intent of not, and I think my issue wasn't that I didn't want to, but I was more like I was afraid, because I didn't have that comfortableness with like local health departments. And I was more comfortable at the time with ministries of health, because that was where my training was. So that's where my comfort zone was. So about, I don't know, maybe a year after that I was here, I got an opportunity again from Freya, and she's like, hey, we need an evaluator, and it's a local program here in Baltimore where it'd be great if you could do this. It's among adolescents. No, thank you so much, but no, it's not my thing. But then there was like this nudge that was still pulling me, and I'm like, well, maybe I should think about it again. So I looked at it. It was completely outside of my area. It was really this program. It was called the Middle Grades Partnership. And the aim of the program was to take these kids in Baltimore City in very poor high schools or middle schools, and they basically bused them to these private schools in Baltimore. And that's where they had this intensive summer program that was really meant to boost their academic skills. So at the time, again, the outcomes, everything was completely not within what I was, studying. So again, I was like, oh, okay, I'll do it. But, it wasn't something that I was excited about. So fast forward, I'm doing this evaluation, and there was a moment that still is with me today. And what happened was that these kids were bused to these big, beautiful private schools in Baltimore. And I was waiting off the bus. And this middle school boy got off, and I still remember him. And he looked, and his eyes were just so huge. And he's like, wow, these kids must be really loved. And I heard that, and it just went through my heart. And I was like, oh my gosh. So fast forward then, again, Freya gets this call out of nowhere from AstraZeneca, really. And it was this opportunity for us to form a team to be the thought leader on this new program, where they were really interested in learning more about adolescents and connecting what they call disadvantaged adolescents to health. So we called it the WAVE study, the well-being of adolescents in vulnerable environments. And one of the cool things about that study was that we got to use the first part of that study as just completely qualitative. And I'm a qualitative researcher. So we had all these amazing methods. So we did community mapping, we did a photo voice. And one of the things that was so shocking to me from that was that, especially in Baltimore, the photo voice and the community mapping, those themes were very related. And the captions of the photo voice were of their neighborhood and of the trash. And the captions were, nobody cares about us. And again, that same kind of familiar quote from that other middle boy kept kind of etching at me and itching at me. And so I was like trying to think about, what does this mean? So again, fast forward, I had started doing more domestic work, and I was part of the Bloomberg American Health Initiative. And one of the first summits that they have as part of this, they have all these outside people. It's more like a show.
But there was this one session that really just, again, made a huge impact on me. And it was a study, a randomized control trial that they had done in Philadelphia. And they looked at the impact of greening vacant lots on the health of adults. And they found dramatic improvements among adults in terms of reductions in gun violence and reductions in mental health. So I started thinking, well, gosh, is there anything like that in Baltimore? You know, and I looked at the literature and there's very little. And then I learned that Baltimore has right now 25,000 vacant lots and an additional 19,000 abandoned buildings. So I started looking at all of this and I'm like, gosh, and I started thinking about all those other points that led me here. And so I started asking this question. I was like, can we start thinking about the neighborhood as a way to improve the lives of adolescents? So I got together this team, and this team is made up of Forest Service researchers. They're made of mental health. I've got people that are greening. I've got city agencies. So this amazing team. So talk about what Dylan was saying, this collaboration. It's been amazing. So I'm on my third year of this study. We all got together and we put together a grant, and the grant is called Project Vital. And it's a study that is aimed at examining the greening of vacant lots on the health of adolescents here. And it's been just an amazing experience. And I stop and I think, would I have gotten to this point had I not had those other opportunities where I initially said no? I don't know, really. But I'm thankful for that. And I can honestly do say, though, that I think at the point when I was first here, I would never have imagined getting an email from a colleague who signs their signature, TGIF. Do you guys know what TGIF means? Thank God I'm a forester. So my takeaway then is, you know, be wary of those nudges. They may actually lead you to some of the greatest rewards possible. So I invite you to take all of those. And I've got other stories too. I wanted to also talk about my pathway to public health, but you've heard so many of that. But if you want to hear some animal stories or anything like that, come to my office, E4620. Thanks so much. I don't know about all of you, but I certainly have put TGIF on things. I never knew I was a forester. So that's great. That's great. I'm going to invite Dr. Shannon Wood to come say hello.
Hey everyone, I'm Shannon Wood. I'm an assistant professor in the department. I'm going to talk about a few different themes that other people have already touched on. But one of the prompts that we got for today was what brings us into the building. And I sort of want to talk about that, but I actually want to really talk about what gets us out in the field too. It's super exciting, especially after COVID, to be back with everyone. We have amazing colleagues, fantastic students. The academics are really, really amazing here. But it's also really about our community partnerships. And so I started working in the community in rural Western Kenya when I was in college. And I continued to work with this community for 4 or 5 years going forward, going back every summer after I finished my master's program, after I finished my first job at the NIH, I continued to go back to this community. And part of the reason was because of the women there and just the gender inequity that they faced in this space. And so we were in a context of widow inheritance, of really high gender-based violence. And we saw that coming from the top too. And I think that that was really the hardest part for me because this was an organization that one of my undergrad mentors worked with. And they were fantastic. They had a really good relationship, but it was really focused on children and not as much on women. And so when I started working with the women, I saw how this was trickling down from the top. And eventually, because of some of these just disgruntled relationships, in some ways, I had to bow out of that project. And that was really hard. Erin talked about quitting, but it's really difficult sometimes when you've invested a lot into a community, but you see that the work that you're doing is actually in some ways probably hurting more than helping. And so that was right before I started my PhD program here at Hopkins. And I kept working on gender-based violence issues, really impact on contraceptive use as well. And that next summer, the first summer of my program, I had the opportunity to go back to Kenya, this time with a project that we've been working with these partners now for, I don't know, 8 or 9 years. They're really, really fantastic. And they care deeply about gender inequity and preventing violence against women and girls. And so sitting down at lunch with the executive director, the first day, I was talking to him about my experience in rural Western Kenya. And he actually happened to be from that community. And he said, that is one of the most difficult places to work. We really need to start here in Nairobi first and understand these prevention programs a little bit better before we can move forward into trying to change some of those harmful gender norms. And that was just, it was the most reassuring thing to understand, okay, someone sees this, a man sees this also. And he cares deeply about this community and about women. And so I've been working with this team now for many years across different projects, but just truly value those collaborations and those partnerships. So I guess my advice to all of you is that it's okay to quit things. Sometimes the timing is not right. Sometimes the people aren't right. But as Celia said, you will have FOMO here. And the great thing is if something isn't working well, you can always pivot. You can always adjust. There are so many different opportunities. And so I just encourage all of you to pursue those and also just figure out what's best for you. Thank you.
Great. So we have a few stories remaining. I'm going to ask Saifuddin and Ahmed to say hello.
Hi, how are you doing? I'm Saifuddin Ahmed. I'm professor in the Department of Population, Family and Reproductive Health. Just like you, one day I landed here as a student. My background, I was a physician in Bangladesh. I'm from Bangladesh. And just for the historical development, this PFRH or Population, Family and Reproductive Health is essentially the composition of two departments, maternal child health and population dynamics. And I was in the population dynamics department. And in the population dynamics department, the focus was on the demographic. And at that time, there was also requirement that you have to have one minor. And you have to choose one minor, either basic science from the sociology, epidemiology, economics, and another one. So essentially, I took epidemiology as a physician. And in fact, I was another school, I was admitted in the UNC Chapel Hill in epidemiology department. In Bangladesh, everybody knows about Hopkins. So basically the focus was, oh, go to Hopkins. So I landed at Hopkins, but epidemiology was obviously a fascination. So I took epidemiology as a minor. Interestingly, now I'm teaching statistics. So that has a history too. In the history in the sense that when I joined a small NGO research organization, as a medical student, as some of you know, in the British system, there was nothing called statistics in the medical school. So I did not know anything about even the standard error or the standard deviation. So I started reading the journal at that time. Medical school, you don't read the medical journals in Bangladesh or any British type of the schools. And then basically I encountered many, many different statistical methods. And I really, at that time, I still remember, you never forget something. It's called the multiple classification analysis. So I asked some statistician, what is multiple classification analysis? And he very sarcastically responded, okay, if I tell you, will you understand it? Oh my God, I have an ego, right? See that I went to the best medical school in Bangladesh, and there was a little bit of ego that only the best go to the medical school. So I thought, If he can understand, I will understand too. And then basically I challenged him that I'm asking you the question today, tomorrow you will ask question to me. And now I started teaching statistics. I was joint faculty at the biostatistics department, and I essentially teach 2 courses, both are statistical courses. And that is the story too. What is that story? I never shared that story with our faculty. And that story is that I joined in the department in the faculty. And so I was sent to a senior faculty to get some advice. I went to her for an advice, and a little bit of the information I received, what are you going to teach? Whatever you have learn from us, we're still alive, right? So what are you going to teach? I couldn't sleep the whole night. Okay, I said, oh, that's a good question. What I'm going to teach? And then essentially I thought about what is not in the department. What is not in the department that I started thinking about. And at that time, I find out one of the lacking was in particular the things that I'm teaching now. And that is basically the analysis of the large population survey. So I started teaching that course. I called a call from the biostatistics department, and the biostatistics department said, why you are teaching a statistical course from the other department? Okay, so that was a little bit of challenge. And somehow they felt like that, okay, he can teach. And so fine, you can teach that course if you also teach another course from our department. So I landed up eventually teaching 2 courses, one from the biostatistics and one from our department, and both are focused on the statistics, like you can see. And I'm telling you this story for 2 reasons. One of the reasons is look at your strength and take a challenge. You can do everything. Everything is possible, number 1. And number 2, not only find out what is there, also find out what is not there. And that not there can open opportunities for you. Thank you.
I have to say, I love these stories and I learn something new every time, but it's wonderful to have data analysis gurus as well as really great friends in the department. So I'd like to invite Dr. Allison West to say hello.
Right. Hello and welcome everyone. So happy to see so many new faces. So my name is Allison West, as Cynthia said. I am also an assistant professor in the department, and my work focuses on early childhood services. So I draw pretty heavily from implementation science and do a lot of deep thinking about why services work and oftentimes maybe why they don't work. So that's where my joy is. Rather than talking about my very long and super windy road to public health, I also did not know what public health was until pretty late in my career. I'm going to talk about what brings me into the building every day. And I think I'll just try to focus on a couple of things maybe that haven't been mentioned. So I'll just start by saying that by way of training, I am a social worker. My master's degree is in social work. My doctoral degree is in social work. And I have a pretty strong social work identity. I worked for many years as a social worker in Baltimore before I went back to school for my PhD. And one of the things that I love about this department is just how multidisciplinary it is. I mean, you've already heard from everyone that's spoken today. We have social workers, criminologists, nutritionists, public health folks, psychologists. And it is such a gift to have all these perspectives here together. And so one of the things I love is reaching out to folks who have different perspectives. I mean, there's so many different perspectives, so many different areas of expertise, whether methodological areas of expertise, content areas of expertise. And it's just such an asset here. So I'll just leave you to encourage you to go reach out and seek perspectives that are different from your own. Those perspectives have really helped me grow. They encourage me to think outside the box. I think those different perspectives are really what make innovation possible. So do go out, seek other perspectives other than your own. And then I also just wanted to mention that one of the many hats that I wear is I direct a national research and development platform called the Home Visiting Applied Research Collaborative. And it's a research and development platform, but also a practice-based research network, which is comprised of researchers and home visiting practitioners and other interested groups all around the country. All my work is domestic, by the way. And really brings them together to create a research agenda that's important and relevant, meaningful and timely to the field, and then conduct research that is going to produce useful and actionable knowledge. One of the things that so I'll just say, I'll back up a step and say what excites me about this, and again, another thing that brings me into the building, is the opportunity, as awe-inspiring and as terrifying as it can be at times, to have a leadership role in affecting public health and broad health at a population level. And again, it's a big responsibility. One of the things that I'm trying to be, again, we're always growing and we're always learning and we're always needing to seek other perspectives. And so collaboration is a big part of my work. And one of the things that I'm trying to do as part of that role is really place a lot of emphasis on collaboration and really fostering growth of the network and fostering collaboration within the network. And so what do I mean by that? One of the things we're trying to be more intentional about, increasingly intentional about moving forward, is making sure that we're involving not just researchers, but practitioners and families who participate in home visiting in every phase of the research process. So that means coming up with research questions that are important and relevant to the field, involving everyone, all stakeholders and all interested groups in designing the questions, designing the research, choosing the measures, interpreting the results, and then having a stake in what happens to those data and to those results to make sure, again, that we're conducting research that's important to the community. And you've heard that theme before. So I wanted to mention that because again, to do this takes a lot of collective wisdom and a lot of collaboration. I could never do it on my own, but it's been a wonderful opportunity. And so again, I encourage you all, I guess my point in sharing all this is just to say, don't be afraid to try new things. Don't try to go it alone. Never try to go it alone. We all need partners. And also, I guess collaborate. Again, I've already said that multiple times, but just make sure you're thinking about how you're engaging different partners, who you're engaging. Are you bringing and welcoming people to the table that might really be an asset to what it is that you're trying to achieve, and letting those folks help you set that agenda to make sure that you're producing work that's really going to affect change on a population level. So again, I'm still learning as I go, but again, I also learn a lot from my students. So thank you all for being here, and thanks for giving me a few minutes. So take care.
Thanks so much, Allison. One of the crazy things about our hybrid environment is you can be on a Zoom call 2 hours ago and then see the same person in person and thinking, oh, right. I saw you earlier today. So last but by no means least, I'm going to invite Dr. Carolina Cardona to say hello, and she's online today.
Hi, everyone. Thank you, Cynthia. So I was actually scheduled to talk last week, but I'm going to share the story why I wasn't able to do it last week. I'm an assistant scientist in the department, and for me, it was quite difficult to pin one story to share. So I'm going to share how I ended up in public health and conducting research on women's health. And my path, I think, is not that different from the stories that we've heard from other colleagues. So I'm going to start way far back when I was in high school. At that time, I really liked mathematics, and I even thought about majoring in something related to engineering, but I wasn't fully sure. But then during that time, I had some economics classes that made me realize that it was pretty fascinating to see how some economists use quantitative data and some models and fancy models to understand human behavior. And the reason of why I thought that was fascinating, but was because at that time we were studying models that explained education and poverty. And during high school, some of my classmates and I used to volunteer to work with children from rural communities in Bolivia to tutor them on mathematics. And in my econ classes, I became more exposed to the field of economic development, which again, I thought was fascinating. And I learned that health and education were major components of it. So after I majored in economics, I worked surrounded by economists who I believe that sometimes you may have known, heard, or experienced. They can be a bit arrogant. They believe that quantitative research and causal inference are the holy grail or what we need to believe. But I was lucky enough that across my work experience in Bolivia, I came across a fantastic mentor who was trained, or I guess is trained as a hybrid between economics, demography, and he introduced me to public health. And the more I learned about public health, it made me realize that understanding the underlying factors or behaviors that we can understand from the public health frameworks can help us better understand human behavior. So fast forward after that experience, I came to Hopkins, as we were all sitting there. I pursued a master's degree and a PhD degree. My PhD was in the department of PFRH. I concentrated in health economics and population health. And during my training at Hopkins, I became more exposed and convinced that women's health and their reproductive health decisions have major implications on the economic development of a country. So that again took me back to my interests when I was an undergrad student, to my interest in mathematics. So I was able to combine all of those passions. So currently my work focuses on understanding women's reproductive health decisions and how in the context of specifically sub-Saharan Africa, they can influence their future economic growth. And I'm also happy to share that some of my current research has drove me back to Bolivia, which is why I wasn't able to join last week because my internet connection was unstable. Because last week I was in La Paz, where we had conversations with representatives from civil society organizations and the government, because Bolivia has been chosen as an exemplar country for progress in family planning. So last week we had our kickoff event, and it was very satisfying and great to be back and contribute in a field that I'm passionate about in my country. So all this to share that I think the takeaway for me would be that even though I've taken different paths that have brought me to my current research and my current work, I was happy to be able to share the different passions that I had throughout my years. And I'm happy that I get to work on something that motivates me. And I always think that we spend a big chunk of our time working. So it would be best, or what is best, that if we can combine that with something that it's passion and significant to us. So I think we're running short of time, and I'm located at the office on E4036. My office door is always open. And this year I'm very excited that I get to interact more with the master's students with whom I had the pleasure to meet a few weeks ago. So thank you.
Well, in case you didn't think the academic year has already started, I think after last week and this week, we've officially begun. I'm really excited about the year ahead. Look forward to engaging with all of you, whether it's in life course or in the hallways or in my office. When I'm here, my door is always open and I'm here a lot. So look forward to getting to know each of you. Thanks to all the faculty who presented. I know we didn't have time for everyone's stories, but reach out to us. We really love working and learning together, and we're off to a great start for the year. So thanks so much, everybody. And a huge shout out to Sylvia, who made this all possible.